Welcome to Nothing Without Us, stories and discussions about meaningful inclusion. We will talk about accessibility, true inclusion, and disability justice with stories, policy updates, discussions, and related commentary on the value of being accessible and inclusive. We believe life should be accessible for everyone, and everyone should be included in all aspects of life. I am your host, Annette Bourbonnier. I am a 70-ish-year-old woman with short gray hair and eyeglasses. I am sitting in a power wheelchair, and my service dog Kirby could show himself at some point during the podcast. This podcast is captioned. Please press the subscribe button at any time during the podcast if you have not already done so. It will not cost you anything, but it will help us make this podcast grow. You are also welcome to make comments in the chat and to give us feedback about what you do or do not like. We especially appreciate a thumbs up. Today's show is a continuation of the Crip the Vote series, where we engage office holders and candidates in discussion of disability issues. Today, I'm honored to welcome Tina Spears, who represents District 36 in Charlestown, South Kingstown, Block Island, and Westerly in the Rhode Island legislature. Representative Spears is also well known as the Executive Director of the Community Provider Network of Rhode Island, or CPNRI as we call it. The disability community is lucky to have Representative Spears in the State House, not only because of the work she does, but also because of her lived experience as a parent raising a child with significant disability. Welcome, Representative Spears.
Thank you for having me.
So, persons with disabilities represent between 20 and 25% of the U.S. population, making us the largest minority in the country. However, discussion about disability issues is just never included in campaigns or other public appearances. So this sub-series of my podcast is geared to having people who hold office or who are running for office talking about questions that related to disability and what you might be able to offer in these areas. So you've only been in the legislature for one term so far.
Correct.
But you've already made a mark in this area for persons with disabilities. Am I correct in understanding that direct caregivers, including personal care assistants or PCAs, will be getting another raise soon?
Yes, you are correct. As of October 1, we have budgeted for, and OHIC has assessed, and EOHS has approved and submitted for public comment rate increases to the entities that pay the wages for workers. So those wages are coming.
Okay, so that's even the personal care assistants that are through like the Fogarty Center and.
So there's like a couple of tiers. It gets a little complicated. So there's certain codes that go along with wages. So 2 years ago, we had a pretty significant increase for the DD community, as you'd call it.
Mm-hmm.
And those are not included in this upcoming infusion October 1. However, if you receive personal care attendance in your home and you're an elder, you're a person who does home nursing, you provide behavioral health supports to children in the community. So there's a whole host of services that did get increases. So for those services, absolutely, there's going to be an increase.
Oh, that's good, because they did not raise them enough for the personal care assistants last year.
Yeah.
I had done a study that, you can go on the online, and find out what the Bureau of Labor Statistics says, and what they were paying 20 years ago. They continued for nearly 20 years. But to buy that same amount, it should have been at least $23.40, and they raised it to $21.
Yeah.
There's and these people don't get any holidays, any vacation. There are no benefits at all, and they are critical people.
Yes.
So that's good, and I'm glad to hear that, because that's really important. Okay, so another big issue. Rhode Island does not have an Olmstead plan. And, that decision's 25 years old. And Rhode Island is one of only 21 states that does not have a plan. There was legislation submitted last year to form a commission.
Mm-hmm.
Can you tell me where that is right now?
I don't have all the details on it, but what I can tell you is that there were internal discussions, from what I understand and know. Internal EOHHS executive. So I don't know if your viewers know about the Executive Office of Health and Human Service. They're the umbrella entity for Medicaid and Health and Human Services.
I try not to mention them because, yes, anyway.
Yes, so I know that they have convened internally to discuss and prepare. I thought there was going to be some stakeholder engagement. I do know that they've sent out surveys, and we've shared them through my organization, through my professional job. But what that will evolve to become is yet to be known.
Right. Well, I do keep getting correspondence from them regarding their efforts in this regard. And unfortunately, my experience with this office causes me to be concerned about their ability to lead something in this arena. They always talk about involving stakeholders, but in the end, they make a decision and try to sell it to stakeholders, and that has been my experience. How can we make sure that the planning for the Olmstead plan truly comes from the disability community?
As it should. So I can say a few things. Having been at this work for quite some time in various roles, right? So a little bit for the viewers, was a parent advocate for many years for my own son, worked in the policy space at a nonprofit organization, worked in the Senate as a fiscal analyst, and I worked for the state for a short period on the consent decree, and now in my current role and my additional role of legislator. So I've had a lot of different perspectives within state government, and what I can tell you is, with changing administrations and changing staff, that always complicates everything. Everybody has a new idea, somebody wants to change leadership, change direction, and that really sometimes can go sideways or not be as advantageous for the community at large. So I always approach things and encourage that anytime a state entity wants to make a policy change, that policy change should be fully vetted and invested in by the community that policy change is going to impact. So when you talk about the Olmstead plan, it's great to have an internal state meeting, but at the end of the day, there should be a combined, public interest meeting with state and decisions made together. I think that's the best policy formation structure. And I encourage that and work hard to see that through.
Right, yeah. I got the survey. I was, there were some of the questions just couldn't really honestly be answered. Like, which one of these is best? And no, none of those. And there was no choice for none of those. And I've created surveys, and that just made me more frustrated because there's a process that we use in creating them, and this one didn't quite make that process. But, we do need to have people with disabilities involved, and people with all types of disabilities, I never separate physical and mental like some people do, because I always say they're all physical. It's all a basis of a physiological variant of some sort. Now, it affects different people differently, but it is basically a physiological variant, which means it's physical. But we all need to be involved, because one way or another, it's going to affect all of us. So some of the problems that Rhode Island has is we do not have the infrastructure to even exist in this state. It is just so challenging. I discussed the issue of transportation with Congressman Amo, and he's got some ideas that he can work on from the congressional end, and I really hope he's able to do that. But accessible housing is an area you've tried hard to work on, And how can we help move that forward? Because, again, there's such a shortage. Accessible housing is such that I can't go visit my friends.
Yeah.
You know, it's that kind of issue, right?
Yeah, so I can, yes, and, you know, just back to your comments around people with disabilities should be included in every conversation, period. End of story. Any policy discussion, any changes to the state, any infrastructure spend, any planning that we do, at the end of the day, all walks of life should be included in that, and it shouldn't be forgotten. It shouldn't be an afterthought, and it shouldn't be the barest of minimum that is required by the federal government. That's not acceptable to me. So that's just commentary. On the housing side of things,
Yes.
if you plan for those who might have accessibility issues, everyone can get into a home. So you can visit anyone's home if you plan in advance. So we are, you know, we're an older community, right? Like, so in the sense that we were developed early in our colonization of this country. So our roadways, our buildings that, you know, predate our own lives weren't built with anything in mind other than right. So like we're in Newport here today, and these roads are narrow, these sidewalks are not adequate for accessibility. It's just really not an easy place to be if you're disabled and have accessibility issues. So I think that we have a couple of things that are at play for why we're so behind in our ability to really change the dynamic for people with disabilities in our community. But I think there's things that we can do. So I put in a bill, legislation last year to say that if we're going to spend state dollars or federal dollars in the state of Rhode Island, all affordable units should be built with universal design principles. So we didn't get too far with that. There was a lot of discussions, there was a lot of concern, there was a lot of questions around what that would look like, and that's entirely frustrating. But we are going to be coming before the Housing Commission under Chair. So we will be in front of Chairwoman Speakman and presenting on what that really looks like. And there's, in Massachusetts, they call it there's a bill. It's called the Thanksgiving bill, and it gets to what you just said. It says, can I go to Thanksgiving at anyone's house if I'm in a wheelchair or if I have accessible issues? And the answer is likely no. So they're trying to do more and more in the form of accessibility and building code. So we have a lot of work to do. We're not doing nearly enough. And even with what is prescribed with the federal government, there are certain criteria if you're over 4 units, but it's not enough. We need to do more. We should just have a founding principle that if we're going to build in the state of Rhode Island, anything from here on should have certain features to make it accessible. We're an aging community. I love, Catherine Taylor from ARP said a quote, and I'll never forget it. She said, we're temporarily able. Everyone is temporarily able. Right, that was Judy Yeoman's comment too. Yeah. She refers to people without disabilities as not yet disabled. Yes. She was a great loss to our community, and she was a fierce advocate and brought us to where we are today. But I think it's we have to take that torch and lift it back up and move the next needle, which is to create a more inclusive environment, which we don't have today. Now, Vice President Harris, may she be Madam President very soon, is proposing millions and millions of dollars into housing, because all over this country we need housing. I'm hoping we make sure that we get the word to that level, that these investments should also include, universal design, so that everybody can, benefit from it. Absolutely. Right. I think that's a strong strategy, and I would I'll make sure that I carry that message to our congressional delegation. And certainly we should be using, for all of us who work in Rhode Island, it's always great also to contact other national organizations that fight for rights at the federal level, so that hopefully they're advocating as well, but it never hurts to reach out to them. Yeah, no, and I'm not afraid to do that. Good. So, So, Rhode Island itself has a significant problem with housing. And many people with disabilities have either been forced out of their homes or will be due to rising costs and the ever-present
what I call PEPs, poverty enforcing policies. So, I don't know where we can go with that, but we do need to change it. It really is, I see, this is the richest country in the world, for crying out loud. We should not have homeless people, and I see them all the time. And most of them have disabilities, either from being homeless or it caused the homeless, either way. And there's really something wrong with that. It seems that that's a basic need we should be concerned about.
I agree, and I will say, I know the House of Representatives, under the leadership of Speaker Sukarchi, has put that front and center. We need to do more on the housing front. It's definitely not enough, and he's said that publicly. All of us have said,
Right.
We need to attack this from every angle. It's not easy. It's not easy to really change on a dime, but I agree with you 100% around the PEPs, like what you titled PEPs. We need to do more to lift people out of poverty and move them into stability. I will say I'd like to do one little teaser around Ticket to Work. That was a piece of legislation that we passed 2 years ago. It's going to be active. We've been working over this last year.
Oh, yeah.
Which
I was in the legislature fighting for that.
Yes,
change.
you were very instrumental in that, as well as some other very strong advocates. And it actually will be going live this September. It's going to be take a little bit of time to make sure it all goes smoothly, but essentially, you don't have to be poor to
Well,
keep your
if you're
Medicaid
under
covered.
65, if you're over 65, you still have to be poor.
Well, we'll fix that too. So
I always seem to get past the break on that.
well, we'll talk offline after this,
Yeah,
but to see what that solve would look like. But certainly, that's a big policy at the state level that's really going to make a difference for people with disabilities to be able to earn
That should,
and keep their Medicaid. So I'm very excited for when that actually fully rolls out for people in Rhode Island.
I actually first fought for it when the Sherlock plan was developed. So,
Oh yes.
So, but I didn't win. But we'll keep at it.
Yeah.
I will. So, well, I thank you so much for joining me today. Tina, it would be so good to have you back sometime. You don't have to just talk about these things during, campaign time. So let's keep in touch. And so, thank you so much. People with disabilities need to have their voices heard. And I thank you for listening to that and for helping make that happen. Thank you for listening. I'm Annette Bourbonnier from Nothing Without Us, stories and discussions of meaningful inclusion. Please hit the subscribe button and give us a thumbs up. We appreciate comments, and tell us who you want to hear from and what issues you want to hear discussed. If you have any questions for Representative Spears, I will definitely forward them to her. And make sure you check out the earlier interviews with Congressman Magaziner, Congressman Amo, and other candidates that we posted recently. Tell your friends about us so we can grow. You can find us on patreon.com and on YouTube. And you can follow me on LinkedIn, X, formerly known as Twitter, Instagram, and Threads. Remember that our democracy depends on everyone getting out and voting. You can't complain about the results unless you do. Until the next Nothing Without Us, I'm Annette Bourbonnier.